Hello, I'm Dr. Diana Bitner, co-founder of True Women's Health. I'm an OBGYN by training, and sleep is something that I've thought about with my patients for a long time. So I really want to get down to business and let's chat about making peace with sleep. This is probably one of the most common questions I get is tell me how I can get better sleep. And sleep is one of the main pillars of our seeds. I want to show you our t-shirt we have now. Got seeds. And on the back are all the different seeds that we talk about. And as you'll notice, it's number 2, right after water. Sleep is one of those, it's such an important pillar of good health. So again, tonight I want to do a let's chat about making peace with sleep. And so starting into it, I want to talk about why I care about sleep. Number one, I want women to be in charge of their health. This isn't rocket science. I want people to understand that good sleep is possible. And so as I think about this, as always, I think about a patient that I've had recently. So Kathy was a patient who came to see me, and she was 46. She has 3 kids, happily married, good job, likes her job, and she is, really life is pretty good, but she's noticed for about the past 4 months, she's had progressive anxiety, irritability. She's had, she gets upset about things she normally wouldn't get upset about. She gets mad easy. She would kind of cry at the drop of the hat. And she said, this is not me. And one of the parts of it is she said, my sleep has been really disturbed. So I started to ask her more questions. Tell me what's hard for you? When did you know that this was really an issue? What made you come in? And she said, my son came home and said, Mom, I'm going to have a lot of people over for dinner tomorrow night. I know you love to make a big dinner. Of course, this is pre-COVID. And she said, she just blew up. She lost it. She said, what do you mean? What do you mean you expect me to make dinner? And his face said it all. She said he looked at me like he didn't know who I was. I always like to make dinner for him and his friends. I always like to have a lot of people around the house. And when he told me that, I just had nothing left and I lost it. So again, Kathy is 46. And so, of course, I'm thinking, I wonder where she is in her cycle. So as the co-founder of True Women's Health, we talk a lot about menopause and midlife and all the things that go along with that. So I asked Kathy about her periods. So she says, well, funny you asked that. About the past 6 months, they've been a little irregular. She said a couple months ago, I didn't get my period for about 5 weeks. And she said, even though I've had a tubal, I bought like 3 pregnancy tests. I was so worried. And she said, and then all of a sudden my period came. But, and then my period came 2.5 weeks apart. And then it was 5 weeks again. And I said, well, tell me about how have you noticed that anything else has changed? And she said, well, right before my period, I'm not sleeping as well. I said, well, do you ever have hot flashes during the day? Well, no. Well, do you have any night sweats? Do you wake up and you're kind of sweaty? And she's like, yeah, I just thought maybe I had a warmer blanket on, but I wake up and my t-shirt's sweaty and I'm sweaty and I wake up in the middle of the night and I have to go to the bathroom and then, I want to change my t-shirt and I can't get back to sleep. And so in talking about this, I'm like, okay, this makes sense. This is associated with perimenopause. And so in having said that, it's, thinking that 30% of adults only get 6 hours or less of sleep. So as we start to talk tonight about making peace with sleep, I want to talk about what is sleep. There's so many theories about what exactly sleep is. I think it's just crazy, that most organisms have some type of a sleep pattern. So we know that it's been something that all organisms of all level of evolution definitely have some sleep patterns. And so it's talked about in the sense that it's for restoration. It's to consolidate our energy and conserve energy. It's to consolidate memories. It's to allow our brain to process through the day. What I think is so curious is that while we sleep, our brain actually expands a bit. The spaces in between the cells expand to allow the toxins to be flushed out, the metabolites to be flushed out. And I think about those pathways that we go to sleep thinking about, those pathways that we're trying to make stronger with learning, get stronger, and the pathways that we don't use as much are cleaned out and go away. So it's also a time where I think about that we make our brain chemicals, that we allow our brain to restore all those things that we need to keep us going in a busy day. And the interesting thing about sleep is that there's very set cycles of sleep. So when we think about sleep quality and quantity, there's a very set thing that happens in a really healthy sleep pattern. And the American Academy of Sleep Medicine recommends that adults get between 7 and 8 hours of sleep a night. And in that 7 to 8 hours of sleep a night, there's about 5 cycles that last about 90 to 120 minutes each. And in a healthy sleep pattern, it's a very regular sequence of events. So the first part of sleep, first there's that little bridge of sleep, that little bridge where we're not really awake, we're not really asleep. That's called N1. So we drop right into a non-REM sleep. So non-REM sleep is when we're not necessarily doing most of our dreaming, our eyes aren't moving. We go from N1, which is that really light sleep, into N2, and then which is really, really deep, 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 deep sleep, and then N3 sleep, which is a smaller portion, and then we drop into REM sleep. REM sleep is where our eyes are moving. So if we're, watching, even like when I watch my cat sleep, the cats have little dreams and they're moving around a little bit. Our eyes move. And so when someone has a sleep study, they can measure eye movements, brain waves, and also muscle movements. And so in REM sleep, we drop into that dream state, but then part of that REM cycle is where really the voluntary muscles are inhibited. They're not moving. And so what I find is so interesting about this part of sleep is that in that time of sleep where our muscles are not moving, if we have something like sleep apnea, where there's blockage in the airways for getting good oxygen, and as we relax and our muscles are relaxed in that part of sleep, then our oxygen levels can go down, and then we can develop obstructive sleep apnea. If we are in that if we're in that part of sleep and our muscles aren't inhibited and we're dreaming at the same time, that's where people can move a lot in sleep and they can hurt their bed partner or they can hurt themselves. And so it's really important in terms of what happens in that sleep cycle and how we go through that sleep cycle. Again, it's really important how we cycle through those sleep cycles in terms of how we actually feel restorative sleep. And so if people have really disturbed sleep patterns, such as disturbed by restless leg, disturbed by night sweats, what happens is that we wake up at times where our brain isn't ready to wake up, and we never really complete these sleep cycles. And so I always think about, we need to get a certain number of sleep cycles to feel ourselves. And even as I get older, I used to be able to go on 5.5, 6 hours of sleep. Now I need 6.5, 7 hours of sleep. So I need that many sleep cycles to feel like myself. And some people say, oh my God, if I don't get 8 hours, I'm not okay. So we all kind of know where our sweet spot is. And again, it's not only the quantity, but it's able to go through that cycle. So for example, recently too, I had a patient who her dogs are waking her up every couple hours. So she's never getting a really good set of sleep because the dogs are waking her up. Or another patient said recently, the dog's up on the bed and hogging all the space. And so, she's getting woken up every 30, 45 minutes because the dog's rolling around in the bed. So she might, in the end of the night, her Fitbit might say that she got 7 hours, but it was very interrupted, even though she could get back to sleep. So again, I think it's fascinating to think about what sleep is, to then think about what are those things going on that might disturb our sleep. I then think about the health consequences. So not only is it that when we're rested, we can learn better, our response time is better, we know that we have better mood, we're less irritable, but there are really important health consequences. So for example, when we're sleep deprived, we also become more insulin resistant. And so when we're insulin resistant, what happens is our fat craves sugar. And so if we're then tired the next day, we're not going to go for a healthy protein bar or an apple. We're going to go for cookies or donuts or whatever sugar is close. And because of that insulin resistance, it can really increase the risk of diabetes. We know that people who are sleep deprived can have an increased risk of cardiovascular disease, We know that people are sleep deprived, especially if they have sleep apnea that leads to their poor sleep. We know that there's an increased risk of dementia. So, especially if we put all of those things together, dementia, or rather the insulin resistance, the diabetes, the irritability, maybe you're not as motivated to get up and work out. Um, that really everything comes together. And I think about midlife and perimenopause the same way. It's like a perfect storm. You've got the symptoms of perimenopause, night sweats, mood changes, and then you have the changes that are going on in your body, the insulin resistance from low estrogen, the insulin resistance from poor sleep. And together it makes that perfect storm where most women gain approximately 15 pounds in that first year after menopause. I'm kind of laughing to myself right now because I think I'm probably speaking to the choir. Like you guys out there are all saying, yeah, we know all this stuff. We're experiencing it. We're gaining weight and it doesn't make sense. We're irritable and we don't know why. We're having more hot flashes and night sweats. We're, my blood sugar is going up. My cholesterol is going up. Yeah, okay, get on with it. Like I know this is happening. Please tell me, what do we do about it? So the important thing, I'd say number one is to understand where you are in your phase of ovarian function. Are you in reproductive phase? Are you in perimenopause? Are you in menopause? Where are you? And it's to know what factors are going on in your body, in your system that are actually making it difficult to sleep. Again, tonight we're talking about making peace with sleep. And so I want you to make peace with your sleep cycle. One of the examples I'll talk about sometimes is for those of you who have children or have taken care of your nieces or nephews or other children, you know that when they're little and babies, for example, if they just start to go to sleep and the doorbell rings or there's all of a sudden a big noise and they wake up and they get suddenly alerted, then to get them back to that state of quiet is like, oh my God, really? Like, did you have to ring the doorbell at that time, right? So we're the same. If we wake up once we get into that quiet place or something is not letting us really get there, then it's hard to get into that initial sleep cycle. So we have to really talk about that initiation of sleep. If our sleep gets really off, let's say you took your kids on vacation and everything was, for 5 nights in a row, it was all great time. It was fun. We're staying up late. We're watching movies. We're swimming in the pool until midnight when the lights go out, and our sleep cycles are all off. To try to get the kids back into a sleep cycle once they get back home and back into school, oh my gosh, it's just 3 days, forget it, right? The same is for us as adults. If we get into a period of time where our sleep is really disturbed, we have to be focused to get ourselves back on schedule. I mean, can you remember maybe letting your in-laws have your kids and you just knew that when you got them back, it would take like 3 days? How is it that we think that we can have disturbed sleep and then just automatically fall back into a rhythm? We can't. We have to be very intentional about how we take care of ourselves. So again, it's number one is to look at those underlying issues. When I was a practicing obstetrician and delivering babies, my sleep cycles were all over the place. The joke was is that the nurses would tease me because I would sit over in the corner and I would be drooling in 2 seconds. I would be out. I'd put my head down and just be asleep. So I was always sleep deprived and my sleep cycles were always disturbed. And so it's just, that's not good for health. So people who are shift workers or are working really long hours and maybe, having to get up, with a pager or, a call that a baby's coming, that's just not good for our health. And so again, it's understanding what our situation is. Do you have sleep apnea? Do you have restless legs? Do you have low iron? Do you have, issues like, let's say, narcolepsy, which is a genetic disorder, which it can make you really hard for you to get into certain sleep cycles. And so then you have this excessive daytime sleepiness. We know that people who have more than 5 arousals in an hour can actually have significant daytime sleepiness. So it really doesn't take much to throw us off. So the more we know about ourselves and we know our underlying cause of poor sleep, it really can make a difference in what we do about it. And so I want to talk a little bit about, again, Kathy. So Kathy was in perimenopause, and we talked about her phase of ovarian function. Her cycles were all over the place. She was in early perimenopause, so likely she might click right back into regular cycles again. And so we talked about the importance of her estrogen and her sleep and her night sweats. And we'll talk about that a little bit more. But for Kathy, it was understanding that not only did she had a lot of changes in her cycle, and that really impacted her ability to sleep, her ability to restore, and her ability to make her brain chemicals and to cope with a life that she had under control before. So also I think about, what do most people trade for sleep? They trade paid work time and they trade commuting. So those are the two most common things. So again, if you're commuting to work, if you're having to work overtime now that hopefully you're maybe back to work, now that hopefully COVID's lightening up. So again, it's thinking about what's going on with you that makes a difference. And so it's always about going back to what's causing it and then how can I start to get back to myself. So when we talk about making peace with your sleep, I number one want you to think about your sleep hygiene. So when we think about sleep hygiene, if you've not heard those words together before, that might sound kind of funny, but it's that hygiene of what we do in preparation for sleep and how we're prioritizing our sleep. So again, just think about the time that you got your kids back from the in-laws. You were very strict with the routine, right? Kids got the bath. They maybe had a snack, then they took their bath, and then we read a book, and then lights out, and we pat the back for a minute, and then we walk out. And then they wake up, and you go back in, and you pat again, and calm down. And again, it might take 3 nights until we're back into the routine. You guys, we adults need the same kind of routine. So it's so important, number one, if you can avoid screen time 30 minutes before you know you want to be asleep, that is so important because the color in the screens, that blue light, can make our brains think it's daytime. And so it's so important to really set aside those screens. I'm guilty as the rest of us. And I now have an alarm set on my phone that tells me it's no more screen time and it's time to get ready to go to bed. Because I don't know about you guys too, is I can catch my third wind at 11 o'clock at night and then, another half an hour is gone. So it's really important to set an intention, set a time, and 30 minutes before that time to make sure we turn off our screen time. The other thing is that a lot of us too, we have so much going on, it's kind of hard to shut our brains off. And so it's so important to take that time to really have some quiet time, to have some meditation, to have some really just time to consolidate our thoughts, maybe get some worries out on paper, and spend that time to just kind of settle down. So I have a patient who says, well, my husband and I, we have a TV on in our bedroom and we really like to watch TV. It really allows us to chill out. And again, we just talked about no screen time before sleep and having just having that quiet time before sleep. And I said, well, how about you watch TV together in bed? If that's just what's going to happen, that's what you're going to do. But then maybe make a commitment to turn the TV off and then maybe even go outside of the bedroom for a little bit just to kind of change the space, give some space to sleep and have that time for gratitude and meditation and quiet time. Wash your face, brush your teeth, and then have your set time. The other thing is make sure you've got a comfortable mattress. It's not all about getting the most expensive mattress. It's just getting something that's comfortable for you, getting a nice pillow, that fits your style of sleep. It's about having a cool room. When that room is too hot or those blankets are too heavy, or maybe that your dog likes to get up on the bed and maybe you have to just set a rule that dog doesn't get to get on the bed anymore. To have that nice cool environment in your bedroom at night. Also, it's to avoid stimulants before bed. So avoiding caffeine before bed is a big deal. If you smoke cigarettes, if you're smoking right before bed, maybe you think you need it to really chill out. How could we replace that with something that will help keep you relaxed versus cigarettes that can actually be a stimulant? Alcohol before bed is not good. It can help you fall asleep. But then a lot of times what happens is when that alcohol wears off, people wake up and then they can't get back to sleep. And we know that alcohol really disturbs those sleep cycles that we need so much to feel ourselves. So it's avoiding those things before bed. It's also maybe avoiding exercise at night. Unlike that, I can exercise at night and I do fine with my sleep. So it's really knowing yourself. But if you do exercise at night like I do, it's making sure you've got time between exercise and sleep to allow your body to settle back down and not think, it's time to get out and get going again. So I use my stretching as my time to kind of start to bridge the gap to a quiet evening. Again, the main treatment is to look at the underlying issues. Is it that you've just gotten out of the habit of sleep? Is that you've got, especially with COVID, we've all even got older kids that have been home a lot more. Is it just that your house is a noisy place right now and you've got to really have some discipline and set some boundaries and some limits about time out, quiet time, and this is the time that I need to get to sleep, and just make it a priority? Is it looking at, again, do you have sleep apnea? Is that something that you need to have addressed? Are you in perimenopause and your hormones are changing and that's what needs to be addressed? And so we're going to talk about those things when we get to the next segment here. And what I always like to do is go into 5 tips that I want to make sure that you leave this with in order to make peace with your sleep. So we'll start with our tips. Tip number 1, I want you to define your picture of self for your future health and for sleep. So at True, we talk a lot about your picture of self. It's having that clear goal for how you want to be in the future. And I don't know about you, but I want to be healthy. I want to be able to keep my weight down. I want to feel good. I want to be clear in the day. I want to not have dementia. I don't want to have a heart attack. And if that is your wish, as I think it likely is, then we have to prioritize sleep. I love what my friend Margot says, is that we can't think we're going to get out of sleep. We can't think that we're more special and don't need sleep. We can't think that, oh, I'm fine, I can do without sleep. You really can't. And so it's to be very deliberate about making it a goal, making it a part of that picture of self for you. So tip number 2, list the triggers that affect you. So we've talked about things like perimenopause. Is that a possible trigger? Let's learn more about that. Is it that you've just really gotten out of sync with your sleep style, with your sleep habits? Is it that you've got a lot on your mind that you don't have resolved? Is it that you do have sleep apnea and your partner keeps telling you, honey, you snore, I think you need to get that checked out? And you're like, oh, I don't snore. I don't want to deal with that. Or I don't want to go to get a sleep study. I don't want it to sleep in some strange place. By the way, they do sleep studies right at your house these days. In fact, they'd rather do that. So, if these are triggers that affect you, then it's really time to figure it out. So I want you to make a list of the possible triggers, like the dog getting up on the bed, and make a plan to avoid the triggers. Again, this isn't rocket science. It just takes you being deliberate and having a clear goal. So, number 3, sleep hygiene. So again, it's thinking about having that very clear sleep hygiene before bed. What are the steps that you're going to take? What do you like to do? Do you like to read a little bit? Do you like to maybe, again, watch some TV to kind of wind down at the end of the evening? But then what are you going to do to bridge that gap and allow yourself some quiet time to allow things to settle before you go there? And again, I would just want to take a time out. If anybody has any questions, I want to make sure that you bring these up. And I'm just looking now on the side. Addressing your bedmate's sleep apnea. Let's talk about that. But just to finish sleep hygiene, it's just being very clear. So sleep hygiene before bed, again, it's about making that time to set that aside. And what I'll recommend to a lot of people is, if you have stuff that you're worried about, write it down on a list so you can get out of your brain. And then what I want you to think about is really practicing some gratitude. I keep a gratitude journal. Every night I write about the things that I'm thankful for. And there's so much research about the power of gratitude to get us out of flight or fight. So flight or fight is where we get into that place where we don't make good decisions. We think illogically about things that we're worried about. And so again, gratitude is what helps us get back into our smart part, tell ourselves, I got that. I'll deal with that tomorrow. I'm not going to give that power to affect the quality of my health and the quality of my sleep. So set aside that time to worry, to to think about it, but then to really get into that place of gratitude. I always keep a couple things in my brain that I'm just so thankful for that when I think about it, it just fills my heart. I feel calm and I get out of that flight or fight. Metered breathing is what can be really helpful to do after we have a sense of gratitude. It's where we close our mouth, we open our eyes, we stare, and just breathe. Just breathe. And some people say, my mind starts to go. Okay, say, I'm going to think about that for a second. I'm going to go back to the sound of my breath. Hear the sound through your nose. Hear the click clock of the clock, the tick tock of the clock. Hear maybe the occasional car outside. But just really be aware of your surroundings. Think of your breath and just really allow yourself to go into that quiet space. And so then go to bed. If you lay there and you think, well, that was stupid, that didn't work, I want you to get back up and do it again. You got to break the cycle. If you're laying in bed for more than 5 to 10 minutes, get out of bed, do your gratitude, do your breathing, settle again, and go back to bed. Again, think about the times when your kids were little, and you had to go back in and pat, pat, pat. So you have to come out of the bed. Don't do it in the bed. It doesn't work that way. You got to get out of the bed, break the cycle, calm yourself down, and then go back to bed. Okay, enough on that. So the next tip is, what if you wake during the night? So I have so many people who say, I always wake at 2 a.m. And when we wake at 2 a.m., maybe it's that night sweat that woke us up. Maybe it's the dog bumped up against us. Maybe it's because our bladder is full at about 3 to 4 hours after we went to sleep. Maybe it's we've completed 2 good sleep cycles and now, we come to that light place in our sleep. If you wake during the night and you're awake more than 60 seconds, what I want you to do, and you're not going to want to do it at the time, but I want you to get up. It will not wake you up if you follow this sequence. Get up, go to the bathroom, drink a little bit of water, and then just sit there. Maybe you sit in the bathroom, maybe you go outside of the bathroom. My friend sits at the top of her stairs. She just sits there for a minute. Of course, don't fall down the stairs if you're sleepy, but she just sits on the top of the stairs. She thinks about all her people in the house that are sleeping, all that she's grateful for, does a little bit of breathing, and then she goes back to bed. And she can go to sleep. If you get back to bed and you lay there and say, well, that was stupid, get back up and do it again until you feel yourself get quiet and then go back to bed. I promise you, it works every time. Even if you have to do it 2 or 3 times, that's way better than either not getting back to sleep or laying there asleep, laying there for an hour and a half and then the alarm goes off, half an hour later. So that's what you do if you wake in the middle of the night. Tip number 5 is medications to consider and which ones to avoid. So again, I would much rather that you follow these tips we've talked about. These tips are also outlined in my book, I Want to Age Like That. It's also outlined in the workbook that goes along with the book. Again, I want you to really follow those things first rather than jump to a medication. And again, it's even cognitive behavioral therapy and all of that good stuff we can use. But sometimes medications are important to maybe get back for acute insomnia, or there's a very stressful life event that you just need to catch up on your sleep so then you can get back to doing these healthy habits. So medications to consider would be first those ones that are not addictive. So for example, even a medicine is Benadryl or a Tylenol PM or an Advil PM, something that takes away the aches and pains a little bit, but that also has that Benadryl, which can really just help us initiate sleep and even help us stay asleep. So of course, sometimes they can make you too drowsy when you wake up, but for most people in that acute situation, a Benadryl can be something that you can take and it can be effective and it's not addictive. Another medicine that's a prescription medicine that I'll give sometimes is called trazodone. It's a very old-fashioned antidepressant, but it can really help with initiation of sleep and to keep people asleep, and it's not addictive. And so again, it's not something that I encourage people to use long-term, but it's something that, especially in an acute time, it can be a really helpful sleep aid that's safe and not addictive. Now, the medicines that have longer-term effects, like Ambien, it can be so hard to get off these medications. They can lead to memory impairment. Women don't tolerate as much of this medicine as men, the standard dose. is really what is not so good. It was the first study to help researchers understand how women are different than men and how we process certain medications different than men. So Ambien can be a drug that can lead to sleepwalking, sleep driving, and can be a really significant issue. So Ambien is one I just really would recommend that you try to avoid at all costs, unless it's the only one that works for you and you're doing it very carefully. Medicines like Xanax or Klonopin, those are long-acting benzodiazepines, and they can help that deep sleep deepen. And again, for some people, it's it's the right thing, but it should not be the first or second or third that you go to. It can help with anxiety. It can help initiate sleep. It can help keep you asleep, but again, they're very addictive. And so it's just to be really careful and use that, under the care of a physician, and to be, again, just very careful about that. So the next thing I'd like to go into is, what are these 5 things that I want to make sure you ask your healthcare provider? These are things that I would want you to ask myself or Suzanne, if you see us at True, to talk to our whole staff about if you have any questions. But if you don't see us at True, these are the things that I would want you to ask your healthcare provider and for you to be aware of. So question number 1, I want you to ask, what is my baseline risk for cardiovascular disease, for diabetes, for depression, for dementia? If you've made your picture of self without a heart attack, without diabetes, without depression, without dementia, if you don't want these things, then it's to know, what is my risk now? Because then as I do things to make myself healthier, how can I see those risk factors improve? And how can I know that I'm making the right direction? If we don't know the landmarks, it's kind of hard to know we're getting closer to our destination. So I would ask your healthcare provider, what is my risk? And there are very simple, straightforward ways with some simple blood tests, some simple other testing is necessary, looking at genetic risk, looking at family history. There are ways to figure these things out. And at True, we take pride in really helping women know all about their bodies and all about themselves. So again, I want you to know these things about yourself. Question number 2, do I have sleep apnea? So again, sometimes it's just a matter of your partner's been bugging you about your snoring. And someone asked a question about, what do we do about our bed partner's sleep apnea? So again, if it's about you or your partner, I would think about, first of all, what do you want? Do you want to be able to learn? Do you want to be able to cope? Do you want to be able to drive safely without daytime sleepiness? Do you want to go through life feeling like yourself? Do you want to be healthy? For us to make change, we have to connect it to something we care about. And I know sometimes my colleagues would say to me, some patients just don't care. And I'll say, I don't buy that. I don't believe it. We all care about something. And I would say to them, you just haven't figured out what your patients care about. You have to figure out what you care about. Ask your partner, what do you care about? What do you want? Just even men who sleep better have better sex. Is sex the important thing? Then let's get good sleep. Let's be rested. Let's stay connected. And so again, if there's even a question of sleep apnea, get a test. It's not that difficult. And sleep apnea is something that can be corrected sometimes even just with a simple jaw splint, to just open the jaw up to sleep better. Sometimes it's losing just 5 pounds can make a difference with how much weight is stored around the neck and how thick the tissues get. Sometimes it's a jaw splint. And yes, sometimes it's a CPAP. And so a lot of people don't want to even get tested for sleep apnea because they're like, okay, they're just going to tell me to use some big bulky machine, and that is so not okay or sexy or cool, or I'm claustrophobic, I can't do that. Okay, that's just one barrier after the other. And a lot of times, number one, the CPAPs are getting less and less obtrusive, more and more quiet. But what I'll tell people all the time is, if you don't sleep, you're not going to lose weight. And so if you have sleep apnea and then use the CPAP for 3 months, 6 months, you start to feel rested, you get the best sleep of your life, and now you actually can function, you can exercise, you don't crave sugar all the time. Now you can get that 5, 10, 20 pounds off, and now you can get rid of the CPAP machine. You only get one life in this body. So this is a way that you can really address your sleep quality and therefore address your entire health. Okay, question number 3. I want you to know your phase of ovarian function. Now, if you have a uterus and you're having periods, then this is a little easier to tell than if you've had a hysterectomy but still have your ovaries, or if you had an ablation, or if you have an IUD. So we can still figure it out. It might mean a blood test. It might mean tracking your symptoms. So we can figure out where you are. Are you in reproductive phase? Are you in perimenopause? Or are you in menopause? And depending on what phase you are, there are very predictable things. Now back to Kathy real quick. So Kathy was in early perimenopause, and she was hitting a time where her ovaries were sputtering. They weren't making as much estrogen. And so in certain parts of her cycles, mid-cycle, right at day 10 or 12 when she was ovulating, and then in those couple days before a period, her estrogen was dropping really quick, and that low estrogen was making her thermostat all messed up. And when your thermostat is messed up, it means that your body wants to cool off at a temperature it usually is comfortable at. So for example, for Kathy, she would get to sleep, but then she would wake up with a hot flash. So 3 nights before, she could tolerate her pajamas on, and she could tolerate that blanket and the bed partner and the dog. But 3 days later, when her thermostat's not working so good, she's hot at a lower temperature. So on those nights, she has a couple choices. Number 1, do your seeds. Make sure you're hydrated, you're drinking your water, avoid alcohol, avoid sugar before bed. Make sure that you're not doing anything else to trigger that thermostat that's right in your brainstem. The other thing is to, that night, go to bed cold. Don't go to bed with the flannel pajamas. Go to bed initially with maybe just a really light blanket. You'll warm up in a couple minutes, but you won't have so much on you that you'll get that much hotter as you go through your night of sleeping. And so just go to bed cold, cool the room down a little bit, and I bet, you'll be much better. For women as they progress into perimenopause or menopause, for example, knowing that low estrogen is an issue, maybe if it's safe for you, you choose to take estrogen. And so that's one thing that can make a big difference. And so it's knowing where you are and having that be an option. For Kathy, she wanted to just really try to do her seeds, to drink her water, avoid sugar, get off the alcohol before bed. It was just so easy. She started having a glass of wine at night to kind of chill. She knocked that out, especially the week before her period, and she was able to sleep much better. But now she knew one of the causes, and she knew that as it progressively got worse, then she knew what to do so she could get better sleep and to understand how sleep affected her moods. So again, just to understand those seeds, if you go to our website, truewomenshealth.com, you can download a free seeds ebook. And that seeds ebook is something a lot of people have printed off and they put right up on their bathroom mirror or they put on their fridge. And it's just reminding of what are those seeds. If you choose to be a patient of True, we have an app that actually you download right on your phone, and you can track your seeds every day or every week. And then you also track your symptoms, your 7 symptoms of menopause or perimenopause or whatever your transition. You can track your symptoms, you track your habits, and you can see how one affects the other. And so it puts you back in control of your health, not your ovaries. Number 4, what treatment options do you suggest? So again, this is what I want you to be able to ask your healthcare provider. You go in and say, I'm cranky, I'm irritable, I'm having a hard time coping with regular life, I'm sleepy all the time, 3 o'clock in the afternoon, I'm craving cookies and Diet Coke and coffee with sugar. I'm doing anything to stay awake to just get through the rest of the day. What do you suggest? So I want you to be in charge of your health. Go into the appointment with a list. I'm never offended by a list. It helps keep us on track. We could talk together for hours about health, but we're there to get some work done. So I want you to show up to your appointment with a list and make sure that we knock all those things off while you are working at this. So make sure that you're in charge and you're asking those questions. And tip number 5, what resources do you recommend? So first of all, I think it's really important for those of us who haven't done meditation, who haven't made this a regular practice. There are some apps that are free and some that are paid for. So there's the Insight Timer app. There's the Calm app. Both those are free and allow you to do a meditation before bed. So maybe you do your meditation, you have a gratitude, you do some breathing, and you go to bed. I really like the Peloton app, $12 a month, and there is a whole meditation section. So sometimes at night, I'll just do a 10-minute restorative yoga to really stretch out after maybe even a hard workout. And then I'll just do my gratitudes, my meditation, and I go to bed. Sometimes I'll do a meditation with Sam Yo or Dennis or Cody, one of the trainers, and do that to really settle in. So there's so many resources. The American Academy of Sleep Medicine has a really nice website with some good options. But again, you'll see over and over, wherever you look, it's about sleep hygiene, it's about habits, it's about having a cool room, it's about knowing those underlying issues that are causing maybe some issues with your sleep. And so again, it's not rocket science. We can figure this out. I know that good sleep is possible. So before we close, I'm just going to look over here at some questions. I see Laura's talking about having cool sheets. I'm with you. I like a high count cotton sheet. Kristen says, do you counsel your patient in fertility awareness so they can anticipate those pre and post ovulatory days? Kristen, I love this because I love, of course, taking care of women of all ages. At True, we have patients from 15 to 95. And for women who really want to be aware of their cycles, if it's to get pregnant or if it's for natural family planning, I really want women to understand. And my patients know that the first thing I do is reach for a piece of paper and a pen, and I'm drawing cycles. So I really want women to know what's going on when your hormones are changing. And let's say that you have a normal 28-day cycle. Again, if you're going to ovulate, your cycle is going to be between 26 and 34 days. So if you're right in the range, we know exactly what's happening. And so, day one is the day that your period starts. And once your period starts, your ovary starts to make estrogen again. So the little cells around a baby egg that's starting to grow, those cells are starting to make estrogen. And we reach our peak estrogen right around day 10. And once it peaks, it triggers our brain to send out another message to then tell our ovary to release the egg. And those little cells around where the egg was, they start to reorganize and they make more progesterone. And so as that happens, different symptoms happen. Even right around the time of ovulation, you might even notice that you have more of a spontaneous sex drive where you just think about sex. You maybe more want to initiate sex. So it's to really pay attention to the cues. You might notice that you have a different vaginal discharge that's more like a thicker, for lack of a better word, thicker snot, thicker mucus. Both words are not good, but we know what they are. You might have veins that are more dilated on your breasts. You might know that because of your higher estrogen levels. So again, I love that you're being aware of that. And again, even just that little bit of a mood change, as you get into that later, we call it luteal phase or closer to the time that your period's going to start, you might get a little bit more irritable. You might get a little bit more quiet. Maybe you didn't sleep well, or just that's how your body reacts to those hormones. So, Kristen, that's a really good question. It's just all about knowing your body. I see Lori's got a question. Do you ever suggest using melatonin to help with sleep? I'm not your number 4. Never get a night's sleep. So, Lori, melatonin can be really helpful, especially if it's to try to get yourself back in the habit of getting those regular sleep cycles. Melatonin works best for people with, let's say, an irregular travel pattern or, well, who's traveling these days, right? But if you have some days where you've got to be up late, some days where you can go to bed early and you just don't have that regular cycle, melatonin can really help with that regular rhythm that our body normally has. At True, I love how Suzanne, our PA, is really well versed in understanding that access of our stress hormones and our cortisol and how they change through the day. And so melatonin can be one of those tools that help us keep it and get back to that regular rhythm. And, for some people, they say it really helps them get to sleep. It helps them stay asleep. And so if it's working for you, yes, it can be something that can be very helpful to try. But I also would really try to understand your rhythm and even come in and talk to Suzanne about, that if you're a patient of True, it's really something we can help you have some boundaries around and really get some thinking about. Dawn, how do you feel about essential oils? Hey, Dawn, I think essential oils are great. For some people, they work better than others, but it's really paying attention to how a certain oil makes you feel, how it affects your ability to relax. And I won't tell you that I'm any expert in them, but I usually keep one right here. I'm looking for it. I don't see it, but I love rosemary. I love having, for me, that's just a really happy oil. And it's not just about being settled, but it can really affect that rhythm, our stress response. And so, again, I don't know a whole lot about it, but I definitely believe that it can be very important. What other question do we have? Oh, Laura saying, I miss those days of before your period. So it can be really powerful to know your cycles and to know your body. So again, guys, this isn't rocket science. This is something that we can all really understand. And again, it's all about having those goals and knowing what we want. And sleep is one of those most important tools to age as we wish. Again, the name of my book is I Want to Age Like That, because we all have a different that. But of course, what I found is most of our that's are happy, energetic, healthy. And again, how I want you to think about it, if sleep were a drug, it would be hard to get. It would be so expensive, it would be hard to afford, because sleep is that one magic thing that helps us have good moods. It helps us avoid heart attacks. It helps us avoid stress. It helps us avoid dementia. I mean, if you came to me and said, give me a drug to prevent dementia, right? I'll say, it's sleep. Sleep is the magic drug. So, again, I so encourage you to take charge of your health and make peace with your sleep. I wish you well, stay safe, and please visit us at truewomenshealth.com. Thank you.